Mr.
You haven't
McMahon,
had
you
time to
said
really
you
talk about
voted
the
against the health care bill. You repeated tonight that it's a bad product and that you want to repeal it and start over. Which portions of the federal law, that is now federal law, would you have in place, still remaining?
Well, first of all, let me address that I do think it was a bad policy and therefore we have a bad product. We need to have bipartisan debate on something so important as health care, which over 70% of our country, and I agree that we do need health care reform. But what this bill did not do, which was what the intent of it to do was to bring down the cost of health care and to make sure there was broader coverage. And what I'm seeing is just the opposite. Premiums are going up. Taxes on small businesses are going up. It will be a squeeze on families. It's a squeeze on small businesses. And also what's happening is in this bill, we are cutting Medicare by $500 billion. Mr. Blumenthal had indicated when the bill was first passed, he praised the bill, said that he thought it was a really good bill. Now he says it's a good first start. I don't think that starting out with premiums increasing a double digit and cutting Medicare payments to our seniors to the tune of about $500 billion is a good start. It's a bad bill. We need to repeal it and we need to start over again because we want to be able to provide insurance to many. But I'm afraid with the reduced Medicare payments, we will continue to see doctors leave the profession or not take Medicare patients, and that is what is happening today. We really do need to look at that because we have, at all costs, need to protect our seniors.
Mr. Blumenthal, you have said you supported the health care reform law, but it is only a first step. It's a good beginning, but not the end. What do you see as the end, sir?
This bill recognizes some fundamental facts. No child in America should be denied health care because they are sick. No worker should be dropped from health care insurance after they get sick. No American family should go bankrupt paying for health care. This bill is a good start because it eliminates some of the abuses that I have fought, pre-existing conditions. Again and again, thousands of people coming to my office. I fight for them because the health insurance companies have denied coverage simply because they say they had a pre-existing condition, or the doctor's out of network, or the treatment is experimental. This bill ends those kinds of abuses, but we need to do better in controlling costs. Medical care costs are spiraling at 5 times the rate of inflation. I would end, for example, a provision in that bill, supported by both Republicans and Democrats, that provides a special giveaway for those pharmaceutical drug companies, prevents negotiations on Medicare rates. We need to eliminate waste and fraud. I see it because I go after it. As Attorney General, we have combined with states and the federal government to pursue healthcare fraud and waste and eliminate or recover millions of dollars for the state of Connecticut. And we need stronger measures to rein in premiums. Just recently, I tried to fight a 20% premium increase by Aetna. I have fought previous premium increases, and I will do so again.
Mr. McMahon.
I have a 30-minute TV show that runs into every home in Connecticut on public access television. I have a 30-minute show on healthcare. It's a very complicated issue. You can watch it on YouTube. The healthcare bill did some good and necessary things. It prevented the kind of abuses that Mr. Blumenthal was talking about. Thousands and thousands of cases where, for example, a woman came down with breast cancer and without treatment would die. And the health insurance company dropped her because she had acne, and they claimed that she had a pre-existing condition that voided her policy. Those kinds of abuses are prevented by this health care bill. It also does some other good things, but it doesn't do a lot of other good things. And if you watch my 30-minute show, I go into great detail about how we should change the system in the United States to both implement cost control and have better outcomes. I do give Mr. Blumenthal credit. He did fight those kinds of abuses as Attorney General, and you have to give credit where credit is due.